Hello, dear friends. Good to be with you once again, and we're going to continue the series we started a few weeks ago. If you recall, we are talking about diabetes in pregnancy, and I've done the classifications already, and I've talked about type 1 diabetes, type 2 diabetes, and gestational diabetes. Today, I'm going to hit right into the discussion by talking about what you need to do in your pre-pregnancy state if you are diabetic. This is very key. So probably you have type 1 diabetes, or you have type 2 diabetes, or probably you don't even have diabetes, but you have risk factors for diabetes. You have a family history of diabetes. What are the things you need to do before you get pregnant? So I'll discuss those who have the high risk factor for diabetes. Now, if you have a first degree relative who has diabetes in pregnancy, you have your father, your mother, or any of your sibs who are diabetic in pregnancy, that means you have a very high chance, a high risk factor for having diabetes. So you have to be careful. So what do you need to do before you get pregnant? By start planning pregnancy, do a screen just to be sure that baseline you don't have diabetes. And if you don't, congratulations, that's good news to you. So you just keep planning your pregnancy, commence your folic acid, and live a healthy lifestyle. Engage in consumption of a balanced diet. Don't take excess carbohydrate or excess of any of this of the nutrients. Be balanced in your approach, your dietary approach to pregnancy. That is very key. The reason is that if you have unnecessary increase in weight prior to pregnancy, not only will it reduce your chance of getting pregnant, yes, excess weight gain in pregnancy reduce your chance of getting pregnant, and excess weight loss before pregnancy reduce your chance of getting pregnant. I'll rephrase that again, so that I don't get to confuse the audience. Excess weight gain prior to pregnancy will reduce your chance of getting pregnant. Excess weight loss prior to pregnancy reduce your chance of getting pregnant. So these are two key factors that will increase your chances of getting pregnant. So you have to maintain a balanced diet approaching pregnancy. Okay, the second category will be those who are already diabetic. You have diabetes and you are planning a pregnancy. The best and the most important thing you need to do is to optimize your blood sugar. Ensure that your glycated hemoglobin, which is a measure of your sugar control within a span of time, usually like 3 months, is under good control. So we expect that you have a glycated hemoglobin level that is below 6. That's what we want to see. So you want to ensure that you're optimized. If you're using fasting blood sugar for monitoring your blood pressure, you want to ensure that you have a fasting blood sugar that is under 110 milligrams per DL. You want to ensure that you have that. So you want to ensure that your blood sugar level is optimized before you go into pregnancy. If you have type 1 diabetes, same for type 2 diabetes. You want to ensure that your blood sugar is well optimized. Also, you want to ensure that you are free from or metabolic conditions or metabolic abnormalities. Don't have any pre-existing medical condition that is prevailing you. You want to ensure that you have control of that. It's also important that your general approach to health is good. Weight loss, weight gain, that's to be the best shape that you can, because you want to get into that pregnancy in the best condition that you can, because pregnancy itself will bring its own extra pressure that can worsen the outlook if you're already diabetic. So remember, if you know that you have risk factors for diabetes, ensure that you get screened. 2, if you know that you are already diabetic, type 1, type 2 diabetes, ensure that you are optimized before the pregnancy. Finally, before you commence your pregnancy,